Hi, I'm Lauren Davitt with UNICEF USA, and we're back with another installment of Ask the Experts. Today we're talking to Mark Hereward, the Associate Director of Data and Analytics for UNICEF. I'm really excited to talk to you today, Mark, since data has become such a vital piece of this pandemic response around the globe. So to start, can you tell us a little bit about the division of data, analytics, planning, and monitoring at UNICEF? How does UNICEF collect data, and how does it inform your work?
Sure. Thanks a lot, Lauren. And it's really good to be here with you today. And this division of data analytics, planning, and monitoring is really two sides of the same coin. So my side, if you like, of the division is the data and analytics. So that's looking at all the statistical, if you like, the external data, working with countries to get the best data and so on. And to use that for advocacy, for planning and seeing how well we're doing in UNICEF. And the other half of the division, the planning and monitoring, is collecting data internally from our programs to track how they're doing and to be able to help plan. And the whole strategic plan for the organization is also from that side of the division. So we really come together, bringing external and internal data together to make powerful messages about children, to help policymakers make great policies that will help the children around the world, but also to be sure that the money that's entrusted to us is used best possible way to be most effective to be able to help the largest number of children around the world.
Thank you for that. That's a really helpful background. So how has the pandemic impacted your day-to-day work? What are some of the challenges of collecting data right now?
So in this crisis, we find that the normal ways that we have been collecting data from countries to be able to use for children are no longer available to us. So we rely a lot on data collected face-to-face through censuses and surveys and so on. No face-to-face surveys happening right now. We rely on a lot of data from administrative data systems, but the first thing that breaks down when there's a disruption of services are the data parts of the systems. So we're trying to find different ways of using telephone surveys, and despite the limitations that there are, or SMS or online surveys, so we can rely on what they were giving us. And there's this enormous value in the data that are already collected and in the database. Then we have to kind of project off that to say, all right, this is what we know statistically, and we can maybe use like social media streams to be able to look and see how things might have changed. So we assume from past experience that locking people down in their homes is going to increase tension, and even more increased tension because a lot of people's incomes have gone away. That almost inevitably leads to an increase in violence in the home, either violence against children or interpersonal violence, intimate partner violence between the adults which the children witness, with very little way of reaching out. So how can we get a handle on where this is happening more or less or something like that through analyzing social media streams, through analyzing news stories as best we can. So we're having to be really creative, both to stand firmly on the great data that we already have, and then to use new ways to build on those to get enough insight to be able to make action for children happen right away.
Yeah, and you touched on this a little bit already, but what can data tell us in a moment like this during this sort of response? And, secondly, what questions are you and your team asking right now?
We can use data really in two ways. One is to look and say, who's going to be most vulnerable? So if physical distancing is one of the most important strategies for reducing the spread of the disease, who's living in crowded households? How crowded are the different kinds of households that people are living in? So we can go back to existing data from censuses and from surveys, and we can identify the geographic areas where crowding is a problem, because we know they're going to need more help. We know that 3/4 of children in sub-Saharan Africa do not live in a household that has hand washing facilities with soap. So that's a massive problem, because one of the main ways that we can protect ourselves is washing our hands. 3/4 of children in sub-Saharan Africa are not in a position to do that. So that's looking at the existing data. But then we need to be looking at what's happening. And so we start by modeling. We start by saying, what if? So we can say, what if health services are disrupted, let's say 40% or 50%, which is perfectly possible. as they concentrate on dealing with the COVID, but also as funding is reduced because of the financial crisis, of people fearful to use services and so on. So if those are reduced, the increase in child mortality is going to be appalling. And we can do modeling to put some numbers on that, and probably about next week we'll be able to have some more concrete numbers. But it's what if, it's not for sure, but it's highlighting, okay, these are the services, and these are the ones in particular which we need to be concentrating on making sure there's a continuity of services.
Great. So just as important as modeling and collecting data is effectively sharing it and sharing it with people who need it. So how do you and your team communicate your findings and get them into the hands of decision makers?
Sharing is absolutely crucial from my point of view. Somebody called me a factivist once. You know, I really believe that data make a difference, but they only make a difference if people are going to use them. So it's a question of how you get the data in a convincing way to the people who make decisions. And that's why in UNICEF we're so blessed, because we have these country offices, you know, around the world. Pretty much in every country, there's a UNICEF presence, and a UNICEF presence which is well connected to governments and to other decision makers, so that getting those data, getting those conclusions to decision makers works that way. We publish them, we publish blogs, we publish you know, brochures, short pamphlets, and so on. But it's really what is done with that publishing that makes the difference, and it's UNICEF's immense network, which is what makes me so happy to do my job, because I can see it being multiplied in so many different countries. Every country has its own context. The numbers have to be used in their particular way for that country.
Thank you so much, Mark. We appreciate your factivist expertise and time today. And thank you everybody for watching, and stay tuned for another episode of Ask the Experts next week.
Thanks very much, Lauren, and bye everybody. Good to meet you all.